First of all, I would like to acknowledge that the North Shore Division, our membership, our partners, acknowledge that we live, work, and play on the traditional and unceded homelands of the Musqueam, Squamish, and Tsleil-Waututh nations. We are very pleased that these host nations each operate their own primary care centers and are our valued partners. This conference today is tailored for older adults. It will feature family physicians addressing key clinical topics, as well as a lawyer offering insights on critical legal matters related to aging. So who are we as the Division of Family Practice? We are an innovation in healthcare in BC. We're designed to support and advocate for family physicians and increase primary healthcare capacity to improve patient health outcomes. One of the main initiatives that the division is currently running is called the Primary Care Network. A primary care network is a partnership between the division and family physicians, Vancouver Coastal Health, and our First Nation communities, the Tsleil-Waututh and Squamish First Nations. Primary care networks have been rolled out across the whole of the province, and they bring together different types of healthcare professionals to work with your family physician or nurse practitioner to make it easier and faster for you to access healthcare that is important to you. It also includes something fairly new called social prescribing, which you're going to hear about today. We appreciate that your health is so dependent on your social circumstances, and so we're trying to bring forward the need to look at more than just your blood pressure and your heart risk, but also what's happening at home. I am really pleased today to introduce our keynote speaker, Mr. Dan Levitt. He told me before I came up here that he is one of a kind. He is the Seniors Advocate for the province of British Columbia, and not every province has one. So we are very fortunate to have Dan with us today, and he's going to tell us about his role and the impact his role has for your healthcare. Thank you, Dan.
Well, thank you very much for the kind introduction. It's an honor and privilege to be here today. I've been looking forward to this morning for a long time, and as was mentioned, I understand there are some other people who are in other rooms. So maybe, is there a spot I should be standing to make sure I'm behind? Okay. So anyway, I'm looking forward to also this being interactive. I can certainly chat enough for the whole time, but I'd love to hear from you. And I think some of you probably have things you came prepared to say, or there may be things that you hear about that provoke a thought that you want to share. So please just yell it out. You don't need to be polite. I was speaking to a group of retired university professors this week, and I encouraged them to comment as the conversation went on. And by the way, so thank you for the organizers. The Office of the Seniors Advocate has a pretty complicated way of getting me to come to events like this. And one of the questions in the questionnaire they have to fill out is, will there be coffee? And what I love about the coffee shops is when I find sometimes I'll go buy a coffee, and the thing that the barista asks you is, would you like milk or sugar with your coffee? And I usually have my coffee without it. So, and I say to them with a smile, I'll say, if I really wanted milk or sugar, I would have gone to the grocery store. So anyway, okay. So I'll stick to the script. Why is there a picture of two people with a plant? So not by accident. I was sitting in a classroom, not much, a little smaller than this, in the early 90s at UBC. I took my undergraduate degree in psychology, and there was an elective that I had to, two electives I had to take that semester, and one of them was a course called The Psychology of Aging. And I thought, oh, okay, that would be interesting. I had no idea it would change the course of my life. The professor Back then, the early 90s, we didn't have these fancy projection systems. We had those overhead, right? The plastic sheet, and then she puts a plastic sheet there. This image comes up. I think it was black and white. Then she tells a story of this was 1976 research. It's still online. You can find it. It wasn't online then. I think online didn't exist back then. And so these two people, Ellen Langer and Judith Roden, they went into a nursing home in New England. They gave all the residents in this nursing home a plant, and they told the residents who lived there, sorry, hang on, let me back up. They told the first floor of the residents there that they are responsible for that plant. They got to make sure that plant is watered, it gets sunlight, and it's fertilized. And then they asked the residents, do you have any questions? Then they left. They went to the second floor, and we're assuming these two populations are homogeneous, meaning that one floor didn't have more dimension than the other. They generally had the same kind of criteria, if you will, to live in a nursing home. Second floor, they give all those residents the same plant, except they said the staff will take care of that plant. Any questions? The researchers left. They came back sometime later. They went right to the second floor and they looked at the health charts they had consent to look at them. They look at them and they saw, oh, there's been an increase in pressure ulcers. You get pressure ulcers, those which turn into decubitus ulcers. They're painful. It's a wound from being sedentary. Why are you sedentary? Maybe because you're not engaged in what's going on around you. And maybe there's less activities to do. More of the residents on that floor had those medications we give people, those antipsychotics that you hear about. So chemical restraints or unwanted behaviors. Some of them were seeking the front door. And some of them had actually lost weight they lost more weight than they should have, and one had passed away. Then, as you might expect, that was the control group. They went to the experimental group on this first floor, and they did better. Okay, you're already ahead. So they gained weight. They had all the things that you expect, less medications, because of one reason. They had a reason to get out of bed. They had a purpose. If you live in a care home, generally, just about everything in your life is done for you. So in this case, something was dependent on them, and it gave them a purpose. So when I heard that, I thought, the usual narrative that I saw with my great grandfather at the time, who was living in a care home then, the usual narrative is a decline, steady decline. It does not have to be that way. Just like aging does not have to be a steady decline. You can do things, and you're going to hear about them today. We have some great speakers today here. You can level and probably even go up. Okay. So just think about that what if today, maybe when you go into these lectures today or these conversations, think, what if everything you knew about aging was wrong and you have a different mindset? Maybe if I drank less coffee, maybe if you do things a little differently, you look at your alcohol, look at these things could be different. So let's move on to the next slide. Oops, one of these should go. There we go. Okay, it's the low one. Thank you. You told me that. Okay, so why do we need a seniors advocate in British Columbia? If you don't know, it's an independent office of the legislature. We basically monitor senior services. Seniors are defined in our province as people over 65. For our legislation, we look at 5 areas: healthcare, transportation, housing, income, and community services. We issue reports. We do outreach like this. You can call our office. We have a 1-800 number you can call, and somebody will answer the phone and speak to you. There's no voicemail in our system. We actually have people there live Monday to Friday, 9 to 5. And the reports we issue have recommendations, which I'll talk about. And our job is to influence government to do the right thing for seniors. They're doing lots of great stuff, but we think they could do more. And we want to hear from seniors and reflect on what you want, and also the rest of the British Columbians who aren't seniors. That's really our first report I issued in June last year was called Aging Matters. You get the double meaning there. It was really our challenge is there's 1.1 million seniors. That's not the challenge. The challenge is that there's almost 4 million people in British Columbia who are not seniors. And our job is to make sure that those people give a damn about seniors. So 1.1 million seniors in British Columbia today. That's 1 in 5. In 11 years from now, there'll be 1 in 4. There'll be 1.5 million seniors. This is good news. And I want to talk a little bit about, you'll hear people talk about apocalyptic demography. A very senior government official on Tuesday night used the term. I was at an event. This person used a term called silver tsunami. Well, think about, okay, so silver is good, right? Tsunami is pretty scary, right? We've had some earthquakes recently, and there's no tsunami warning. So think of this, that tsunami, what could it do to us? If it hits the shore, it'll damage things. It's unpredictable. That's not seniors. We've known about this demographic trend for a long time, and I don't think seniors are causing harm. When you hear it, we heard recently, again, some things like, we've heard senior people in government say things like, the population is growing BC. That's good. That's immigration they're talking about. And it's getting older. Hey, are you blaming seniors for this? I think you are. Because look at the hospitals, right? Why the hospitals? Who's in the hospitals? Seniors. They're blaming you for the blame. And then the next thing is, and doctors are retiring and nurses are retiring. Okay. Right? So that may be the reality, but they're also suggesting. So just listen to the language around that. So this is a good thing. Aging is not the problem. Ageism is. Okay. So just keep that in mind. So, and then the oldest baby boomer today is almost 80. I'm going to introduce you to some baby boomers later on, or reintroduce you to some baby boomers. And some of you are probably baby boomers. And then the oldest baby boomer in 11 years will be 90. So by the way, I want to talk about generations. When you say baby boomers are this, the only thing you can say they are is the dates they were born. Any other thing that you characterize that generation about, other than maybe living through certain times, influencing society, anything else from my point of view is a stereotype. Because if you say the same thing about Ys and X's and all the other generations, it's suggesting one group of people are all the same, and we don't do that in Canada, right? We shouldn't do that in Canada. That would be ageism. For 12% of all seniors right now are 85. That's good news. My dad's 88. We're spending the evening together tonight, and 17% of all seniors in 11 years will also be over 85. We'll talk about why 85 is important in a moment. Let's get the next. Oops, I'm pressing the wrong button. There we go. Okay. Some myths about, I love the mythology around aging. One of the myths is that seniors are all dependent on the system. You'll hear other people talk about why seniors don't or should be taking less resources from, if you will, society. But the majority of seniors live independently, and thank you very much. They don't need the kind of assistance that people might think. That does change at 85, where 1 in 4 are dependent, but 77% are still living independently. It does change at 85. That is that number, where a third of the seniors will be living in assisted living, long-term care, or getting home care at home. The other third of seniors are supporting that person. And the other third, you think of the third of you here, maybe you're trying to think, I'm not going to be the person in care. I won't be supporting that person in care. Well, then you're dancing and you're romancing and you wish the music would never stop. So our challenge, I think, really collectively, and I think this is what groups like the Division of Family Practice do, is ensure that the caregiver and the care receiver are doing well. 80% are homeowners. Many seniors in BC are house rich and cash poor. That isn't the case, my understanding, in all of the North Shore, because I know the new Sunrise, not far from here, is filling up, and the amount of money they're charging is substantial for long-term care. Big numbers, a lot of money. People are paying it, and they're not necessarily selling their house here. They actually have the resources. So seniors are doing well. Another myth is that seniors are wealthy. Not every senior is wealthy. The median, which is the midpoint of income in BC for seniors, is $34,000. So think of about $3,000 a month seniors are living on. Think of what rent would be, etc. And a quarter of seniors are living on $23,000 a month. Sorry, a year. Did I say a year? So it's $23,000. It'd be nice if it's a month. be really nice. That would be wonderful if that was the case. So $23,000 a year is their income, $2,000 a month. They're not moving to Sunrise or Amica. They're aging in place, hopefully. Okay, so the homeowners. Oh, so I'm mentioning that because think about this. At 55 in BC, you can defer your property tax. So I turned 55 last year, and I'm deferring my property taxes because guess who's going to pay them one day? My kids. You'll never have to pay your property tax ever again. And if you're a really good citizen and you're thinking of your city, you're thinking you don't want North Vancouver, or if you live in West Vancouver, you don't want the streets to have potholes because people aren't paying property tax. You're worried about all those services. You won't have places like this. Don't worry about it, because what happens is the provincial government funds the city the difference, and the interest rate is the best. If you have any debt at all, the interest rate is by far the lowest you can get. Okay, so I wrote an op-ed in the Vancouver Sun about this last year. I'm encouraging people to consider it. I'm not telling you to do it. I'm saying here's an option of throwing money in your pocket, that if you need the money. 1 in 5 are renters, which is the big concern in British Columbia. Good news in the provincial budget that was released on Tuesday. The government, this is 2 years in a row, has increased the SAFER program. This is rent subsidy for low-income seniors. So they've increased the rent threshold, so more of the rent is calculated. It's still woefully inadequate. It's below, I think it's about $1,100 now, somewhere in that range. Only a few thousand more people will be covered because the income threshold's been raised also, and the subsidy's gone up by $100. Interesting, when you look at the provincial budget, there's another rent subsidy program for younger people, and that one went up. I think I'll double check my numbers, but the seniors program, SAFER, went up about 30%. The other program for under 65-year-olds went up 50%. Okay, I have a certain bias here, and I would love to see. So that's the homeowners piece. 14% of seniors are employed. Okay, here's what happens, and some because they need to be, some because they want to be, some for both. But here's the interesting thing that happens in British Columbia and in Canada. And we're releasing a report on ages, and we did a survey. Some of you might have completed it in the fall. One of the things we found out about is age discrimination is most common in the workplace, and it cuts both ways. You may have experienced this. Younger people feel discriminated in the workplace. Older people do too, for different reasons. Things like being asked when you're going to retire. And I work with someone, and I'm curious when my colleague Bruce is going to retire, but he might be curious about when I'm going to retire too. I'm not, but if the boss says when you're retiring, after a while, it gets a little tiring. Tiring. Okay, got it. I didn't mean to do that. But here's how we celebrate your 65th birthday. And I'm double checking the facts, but I'm pretty sure if you deliver the post, so if you're a federal employee, if you work for the city, maybe in this building, if you are a paramedic, a nurse, or a teacher at 65, we honor you by taking away some of your benefits. You lose long-term disability. That's if you can't do your job for mental or physical reasons. We don't pay you anymore, but at 64 we do. We also take away your life insurance. So if you die, you get a small payout of money, or your heirs do, and also something called I think it's disability or dismemberment. I can't remember the term is, but it's AD&D is called, which is another benefit. And I was speaking to somebody in Ottawa this morning who does some advocacy globally around seniors, and she says her husband's at 66 just told her that as a lawyer, he just lost his benefits at work. So this is what happens. And people will say we can't afford it. Well, 65 is an arbitrary number. It could be 60, it could be 70. And why is it important? It's important today for seniors, but it's also really important I can tell you, my nieces are 30, and I know their amortization schedule for their condos they bought in Langley. They won't be able to pay them off. They're going to need to work past 65. So we got to do this for future generations, making sure. And one more thing about older workers. At 70, in your early 70s, because of the RIF, right? Because you have to convert your RSPs into RIFs, which is also an issue we're fighting, because we think you should be able to do that whenever you want. Because even at death, if you have that money, government can still get the taxes. they want your income tax money at some point that you've deferred. So they'll get it but they don't need to get it necessarily on your 71st birthday, right? They can wait a little bit longer. The actuarial can figure this out. But so what do we do? If you're a government employee, you will lose your pension contributions. You still get your pension, but you can't contribute any further. And then, so Margaret in our office, you call our office, she'll answer the phone. She's 72, and she doesn't get the same benefits as the person in the cubicle next to her. They're BCGEU employees. That's the contract. I'm fighting that, and we should fight it. 41% of seniors volunteer. So, and without you volunteering, stuff doesn't happen. The social services, the nonprofits, churches, whatever you're volunteering, none of that happens without you. So seniors are really the backbone of that whole area. 80% have a driver's license, and I was talking to some of my physician friends this morning. So I think we figured out a little loophole, which I just learned this morning. So the loophole is this: when you're 80 and older and you got to go get that medical examination to prove you're fit to drive, book an appointment for a physical. And then just while you're there, have the doctor, I'm not going to be friends with doctors anymore, but have them fill the form out while you're there, and they'll charge you hopefully $30, not $270. Some people are paying, I don't know if anyone's had this recently, you might have paid several $100s for this test. So I'll be talking soon to the medical services plan to have it covered as part of their regular billing so that you don't pay out of pocket. Why is it important? Because we're going to hear about this today in some other conversations. Because it forces seniors when you can't drive any longer to be socially isolated, to not be able to, how would you get to this place here if you couldn't drive? And how do you get your groceries? How do you continue to be part of the world around you? So it's really important that seniors continue driving if you can. I'm all about road safety. My dad, who's 88, he's had these tests a few times. His granddaughter, my daughter who goes to U of Vic, she's 19. She drives also. Guess which one had a car accident in the past year? And she also didn't have a medical examination. And then the transit system, good news, our budget this on Tuesday did include more money for HandyDart. HandyDart should, if you're using HandyDart, familiar with it, it shouldn't be there just for appointments. It should be there for getting to places like this and other things to help you with the quality of life. And the transit system actually, well, it's accessible, which is good news. I found out recently they're also responsible for going from your front door to the bus stop. So what the sidewalks look like. So we're very concerned that our cities are age friendly. The last one here is dementia. I was at the Breakfast to Remember yesterday. That's the Alzheimer's Society, which is a really important organization to support. And they have a great program called First Link. You have dementia, they'll connect you with the services and help you on that journey. But again, another myth about growing old is that if you live long enough, you'll get dementia. That's not true. Okay. So yes, it's more common as you age, but age itself may be a factor to get it, but age doesn't cause it. Okay. Because if age caused it at 90, right? Okay. So it doesn't cause it. It's more likely. So if you can't remember what you had for lunch yesterday, it's okay. Don't worry about it. Don't fret about it. I tell my dad, if he can't remember what his son-in-law told him the other day about himself, don't worry about it unless it's about my sister. You don't have to be concerned about it. Your keys. Okay. When you go home, you'll put your keys in the same spot every time, right? Okay. If you fail to do that, you won't find your keys. If you find your keys and you don't know what those keys are for, call one of your doctors. Okay. That's dementia. Okay. Dementia is not, don't worry about it. So I'm not trying to minimize it, but really my theory is, and I'm sure there's experts here that can comment exactly why this happens, but at some point in your life, you have all that gray matter, at some point it's full. There's no more room. So someone's talking to you and you're like, I can't absorb it. I can hear you right now. I will remember in a few minutes. Just, there's a comedian, Paul Reiser, if you remember him from Mad About You. He has this whole bit about this. He calls it, he doesn't have short-term memory. He has short-term now. he basically he's talking to somebody, and the person says he asks his friend, oh, did you go did you go to Calgary? Did you go there for work or pleasure? He says the latter. So which one's that? That happens to all of us. So okay, so let's move on to the next topic. Okay, here we go. So okay, the biggest issue we hear about is affordability. Income's the number one issue here about seniors. Seniors are more impacted by this than younger people, certainly more impacted by people who are working, because you can't go out and get a second job. I mean, most people can't. Most seniors can't. And so you're stuck with the income you have. There's not enough affordable housing. Last year, 14,000 people in British Columbia applied for seniors housing. Less than, or approximately 6%, less than 1,000 people, but 6% got affordable housing. So 94% did not get it. That's not a good rate. Okay, so we made these recommendations. I think I touched upon all of them. The BC Senior Supplement, that's for people on the lowest income. We want to see the index to inflation. It's not indexed to inflation. When I asked the Deputy Minister of Social Development, who's responsible for this program, on Tuesday at budget lockup, her response was, well, at least we didn't decrease it. Shingles vaccine. We didn't see that included in the budget. Last year, it came this close to getting put in the, it was in the budget, but got taken up at the very last minute. Unfortunately, because of how much we could borrow. But Dr. Henry certainly agrees we need to have this available. From my perspective, of course, we need shingles vaccine covered. 1 in 3 of us will get it, more likely to get it as you're a senior. The cost makes sense, but we need a suite of vaccinations for seniors that are available, just like for children. When you're born, you get vaccinations. We should have the same thing for seniors. So shingles, I'm sure my family physician friends will say which ones are needed. So shingles, pneumococcal, influenza, RSV, and COVID. They should be available, and probably others. Okay. Good. Thank you. Okay. So reimagining aging. So I want to, the happy stuff, those were difficult topics. This was not so difficult. So yes. Oh, microphone, is it better like this? Oh. Oh, too high? Lower? Oh, sorry. Okay.
He said he would take them as we go.
I'll take this one then, and I'll keep on going. Okay.
So can you add to your list next time aids to daily living? Because as a person who moved from Ontario in the last 10 years, I go back to Ontario to buy my CPAP, to buy my hearing aid. So that should be on your list too.
Okay, thank you. I could pull. Thank you for raising. I could pull up from my briefcase, but I have the budget document that they show that from Tuesday, and on the cover of the budget document, I'm laughing because it's just, I can't believe that this happened. There's caricatures of British Columbians, like kind of like sort of cartoonish kind of outlines of are the shapes of people, and when I look at them, on the left, there's a couple. A husband and wife, I think, holding their kid, walking. So it kind of looks like that's a family. Then there's, I think, the grandparents next to them. But there's a woman, is the fourth person, and she has a walker. And you think so? Let's say this room is representative of all seniors. Let's just say that one person in this room has a walker, from what I can see. So most of you don't have walkers. Okay. So, but to your point. Here's the interesting thing, and I made sure all the political pundits heard me say this, is that when I saw the walker, I thought that's really humorous, because first of all, it's a stereotype. Like, it's not humorous; it's a stereotype of seniors using walkers. Because not right. Okay, I made the point already. But here's the best part: is that very walker is not included in the budget. Kind of like saying, here's something you can have, but we're not going to give it to you. Okay, so reimagining aging. So there was a guy in south of the border who's 82 years of age who wanted to keep his job, but why did people say President Biden couldn't be president any longer? He was too old. Okay, so he did have other things going on apparently, I don't think it's ever been public what they were, but everyone had their own idea of what was happening there. Too old. Okay, I want to reintroduce you to three Englishmen who no one will say are too old to do their job. So you know their names. Roddy Woods, he's missing part of a lung. Mick has had cardiovascular surgery, and Keith Richards, God only knows what's keeping him alive. There's gonna be some conversations later on. I think Hector's talking up later on about alcohol, I think. Okay. Which is what, and by the way, I think you can buy Jack Daniels again. For a while it was taken off the shelves. Now it's back on the shelves, maybe. Anyway, so the Rolling Stones. So they were at BC Place Stadium on July. My sister introduced me to the Rolling Stones 50 years ago. So for her birthday, I took her there. We bought the cheap seats in the very back of the floor. We had to stand the whole evening. That's a long time for anyone to stand. In fact, my sister sat down for a little while. Not these guys. Mick's dancing on the stage, skipping. He's hitting the high notes, the low notes. He's Mick Jagger. Okay, and I want to be clear because you're thinking, Dan, you're sugarcoating this. Well, okay, yes, they're not exactly the same performers they were on the Ed Sullivan Show in the 1960s. They are a little different. However, they're the Rolling Stones, and they're basically a couple years younger than Joe Biden. Now, I mention this also because they just won Best Rock Album of the Year at the Grammys. They sell out stadiums, and no one will tell them they're too old. Their song "Give Me Shelter," the first 4 lines of it. Anyone want to sing it? I'm not going to sing it, but anybody want to sing it? Now's your chance. The first line is "A storm is threatening." You can say that's the age wave, the silver wave coming. My very life today, our quality of life. If I don't get shelter, if we don't build enough long-term care, assisted living, affordable housing, and the last one is I'm going to fade away. I'll be lonely. I'll be isolated. I'll be socially excluded. I think that's my last point. Okay. Oh, if you know anybody who's waiting for long-term care or moved in recently, please have them complete the survey. Where for our long-term care report, we're going to make sure there's a plan for long-term care that we can build enough and we can staff those places, and it's affordable to build for everybody, including the government. But we want to tell the stories of the caregivers and the people waiting for long-term care and what it's like to wait while you're eligible for long-term care. So I'll leave that for a moment. So any questions at all? Happy to answer any topic whatsoever. And if anybody has any advice about the Canucks, I'd love to hear that too. I see. Yes. Okay. So the question. Okay. I want to speak to this. Okay. This is a good one. So votes. Okay. So your voice. There used to be a group called. So I'll repeat. Okay. The question really was, will they do anything if seniors don't vote or if people vote? So think of this. 20% of all British Columbians are seniors. I don't know of another group that has more people than seniors. If you were to start to, and no one likes talking about this publicly, but if you start looking at other groups of people. I mean, unless you said how do women vote or how do men vote, because I guess but if you look at other categories, you're a huge juggernaut, if you will, of people, and then you'll have more in the next 10 years. So how you vote is really important to government. This is how important it is. I was a speaker last Thursday at the Canadian Association of Retired Persons, Zoomer magazine. You've seen it. So that's CARP. Moses Namer, who's a media person, he said, and he's the president of CARP, he said that they need members. They have 250,000 members, but they need 1 million members because if at 1 million, the prime minister will listen. And if you're thinking about, and he was, getting people worked up about this, but if you think about where government can find money, that's, to the point about the BC Senior Supplement, there's money there. There's money being shelled out to seniors that they could redirect to pay down the debt, to do something else. So I think it's really important that you vote and you make sure yet seniors' issues are front and center.